we'll be showing you guys different settings pharmacists can work in.
Hi, my name is Sarah and I'm a pharmacy student at NDSU. I'm going to be demonstrating today how pharmacists use remote patient monitoring to help patients and doctors assess appropriateness of medications. So for some conditions like high blood pressure, it can be difficult for patients to tell if their medications are actually helping them get near their blood pressure goal. Pharmacists can take blood pressures manually, or they can use machines like this to help patients take their own blood pressure at home. For this blood pressure monitor, all I have to do is turn it on. After the machine finishes taking my blood pressure, it automatically uploads it to this app on my phone. This phone can connect to an online portal where my doctor and pharmacist can look at my readings and assess if I need to make any medication or lifestyle changes. This is just one of the many ways that pharmacists can be utilized to monitor patients' progress from the comfort of the patient's home, so they don't need to come into clinic as often as they normally would.
Oh no, I think something's missing. This is much better. In a community pharmacy, there are many roles. The tech or the intern will get information sent over by the doctor, and they'll check that and fill a prescription for them. As a pharmacist, I would check to make sure that they filled it correctly and that everything is accurate before the patient receives it. So I will be checking the intern's work. This is done by counting by fives. Now that this medication is all checked and ready, we put it in this bag for the patient to come and pick it up. Have your prescription ready for your antibiotic here. This will help you feel better. You'll want to take it every day with food for the whole 10 days. Do you have any questions for me?
No, thank you.
My name's Audrey.
And I'm Connor.
And we're both pharmacy students in our second year of our graduate program. And today I'm going to be playing the pharmacist, and he's going to be an example patient. And one of the possible duties that pharmacists can do is give immunizations or vaccines. This is usually done in a community pharmacy, which is like our CVS or our Walgreens, but it can also be done in different health clinics. So normally this vial here would be our vial of drug or our vial of vaccination, but right now we're just using sodium chloride because this is a sample situation. What we'd do is we'd pop the cap off of that, we'd use an alcohol wipe, and we'd make sure that that is sterile. And then we would get one of our needles and syringes, open that on up. And this needle is for an sub-Q administration. Just put the needle in, turn it upside down, hold it in a specific way, and drop our fluid. Cool. And we want to make sure there's no big bubbles of air in there because we don't want to be putting that in the patient's arm. So generally you just hit it a little bit, and then all the air bubbles, or most of them, go to the top. And then you take out the needle and you can recap it until you're ready to inject it. So if this were a real clinical setting and Connor here was my patient, I, before injecting him with anything, would ask him a number of screening questions to make sure that he's able to get this vaccination. But let's pretend like we've already gone through that and he's already read the different statements that he's supposed to read about the vaccination. So first, before injecting a vaccination, you want to be sure that you're injecting in the right area of the arm. So for sub-Q administration, you look at the back of the patient's arm, you go about halfway in between, and you grab just a part of the skin behind it. You take an alcohol swab and clean up the area and let that dry. And then you would take this, take off the cap, position your finger in a certain way so that you're able to push on the plunger when needed. Put it into the right position by squeezing the skin, put it in, and squeeze the plunger. Wait a couple seconds, and then take it out. Then you would add some gauze, just in case there was any bleeding, and a Band-Aid. And then they're all done.
Hi, so the next type of vaccination that we're going to do is an intramuscular injection. That just means this goes right into the muscle, usually in the arm here in the shoulder region. So what you're going to do to prepare it is kind of the same as the other one. You're going to get your vial of vaccine. This is just going to be sodium chloride. You're going to wipe it off to sterilize it. And then you can get your needle ready. Take out the package, attach the needle to the syringe. And then you would take the cap off and put it into the stuff. And you draw up the correct amount of the vaccine. So now we got the vaccine prepared, we got to prepare their arm. One thing to note before that is that the needle length for the intramuscular vaccines is longer than the subcutaneous one. So you just want to make sure that you're using the right needle for the right vaccine that you're giving. So we're going to find the spot. You're going to feel for a bone right on the edge of the shoulder and go 3 to 4 fingers down. You're going to mark that spot with your finger and clean it off with an alcohol swab in a circular motion. Then you're going to stabilize your arm with your hand. Hold the syringe like this. You're going to put it in the plunger, and then you're going to pull it straight back out, and you're going to flip this little safety device over onto the needle so that it doesn't poke you.
Speaking of safety devices, like the intramuscular one had this different pink plastic part that went over the needle in the end. You may have noticed that the subcutaneous needle doesn't have a device like that, but it's made so that if you push hard on the plunger in the end, the needle just disappears right in.
As you guys can tell, there are many different settings pharmacists can work in. And I want to talk to you guys about even more settings that pharmacists can work in. We have our pediatric patients that take care of our children, including providing alternative dosage forms and also specialized drug therapy monitoring for pediatric patients. And we have our nuclear pharmacists, which involves ordering, receiving, storing, and controlling inventory of radioactive drugs. And we have our poison control pharmacists, and they deal with toxicology consulting. And we have our compounding pharmacists that prepare customized dosage forms or prescription medication that meets an individual patient's needs. There are many more settings pharmacists could work in. I hope you enjoyed our video and you learned something new about pharmacy.